in line is by Dr. Parikshit Gogate, who has joined, I think, and he will be talking to us on what reviewer wants.
Thank you, Professor Joshi, sir, for giving me this opportunity. May I share my screen, sir?
Yes, sir, sure. Dr. Parikshit is president of Maharashtra Ophthalmological Society, and to his credit, there are more than 100 PubMed Index articles and many instruction courses. His area of interest is cataract, pediatric, squint, refractive surgery.
Thank you, sir. Thank you for the kind introduction. Can you see my screen, sir?
Yes, sir. Yes, sir. Yes, perfect.
Okay. One is, of course, thank you for inviting me to speak in such an esteemed panel. Well, we know why we want to read or write a scientific paper, because essays are easy to write, magazines are easier to read, they are more colorful, interesting. But then scientific writing is different, because we are not just healers or fixers of broken bone or ancient eyes, but also men and women of science. And well, that's why we have to do this. So in this, the science part is most important. A properly framed research question, a honestly done inquiry, why, what, where, whom, which has been honestly reported and adequately discussed, gives us a proper scientific answer. And a properly conducted scientific inquiry will always find publishers, even if it is not well written. There are editors who will polish up things for you. But a flaw study may not have takers, even if it is well dressed. So an excellent icing cannot always disguise a half-baked cake. So, well, we owe it to our patients, co-workers, and the ophthalmic fraternity that the results of a novel observation or a study are reported. And of course, if we are in academia, then we need it for funding and for our survival, publish or perish. So earlier speakers, Dr. Viral, Dr. Sunil Morikar, Professor Agrawal have gone into this, the IMRD format, what it is, so I will not go into this. I will speak from the reviewer's perspective. Well, reviewers are not enemies, but well, in some ways they can be rivals. So like we have Abhimanyu, who had to fight, 6 Maharathis at the same time, and well, he ended up dead at the end of it. So that also happens with so many of our scientific papers. We take a lot of efforts. We think we have done a very good job. And well, some reviewers, just kill it. And well, they do it in tandem or they do it alone. And like Abhimanyu, we are just caught up in a chakra view. We go with a lot of preparation. And at the end of it, well, nothing comes up. Well, what to do about it? How to think of it? One is, of course, in the title page and all, it does not go to the reviewers. But the abstract, the synopsis or summary should be standalone. And this is one that is written last, written best, because this is the most read part of the paper. So we must spend quite a lot of time on it, because many a times a reviewer, when he or she wants to decide whether they want to review a paper, first what they will see is the abstract. So the abstract has to be very, very well done. So, once the entire paper is done, then we go to the abstract and we polish it again and again, so as to make it as succinct and as, again, interesting as possible. So this is our abstract of a famous study in which we had compared phaco with small incision cataract surgery. As far as the reviewers are concerned, when we are doing the introduction, we should say what is the importance of this study? Why was it worth doing in the first place? There should be a rationale to it, and we defend the model. Suppose we use a case control, or we used a cohort or a randomized control trial. Why did we do that? We use only past tense. We organize ideas, only one major point in a paragraph. And we present the background information, only that much is needed. So if we are writing a cataract paper, we don't go from Jacobs-Daviel 1769 onwards. We just go as to what we are doing with this cataract at this point of time. Again, the materials and methods, this is the heart of the paper. It is the most important part of the paper. And this is where what is finally going to decide whether this paper is going to be accepted or not. The number one thing. So we must be very, very good at it. And a few words on ethical considerations are very important. And we describe all the equipments that have been used, all the instruments that have been used, because reviewers always have multiple doubts. When we go to the results, well, we have to write it a completely objective report of the results. We don't do any interpretation here. We summarize the findings in the text. We point out to relevant observations. So in 400 surgeries, even if there is a single nucleus drop, well, we have to point that out. We have to provide the context, the question that was used to give this answer. So this is needed a lot in a lot of the questionnaire-based studies that we do. And of course, all the analysis has to be presented over here. And again, reviewers get very worked up if the same data is presented twice in the text and again as tables. Don't interpret over here. Never include raw data. Use past tense. And number figures tables consecutively, each properly titled and with a caption or a heading. Reviewers are like examiners. They are busy. They have many other things at hand. And anything that seems shoddy, poorly written, dodgy is, always shown the door first. Discussion is we provide the interpretation of the results and support for your conclusion. Where this result came from and what does it mean? And the significance of the finding should be clearly described. This is the place where you interpret your data in appropriate depth. And perhaps the hypothesis that we have may be supported, may be rejected, or perhaps it may be that we cannot come to a discussion depending upon what we have done. Well, we should accept that. And even the limitations of the study need to be mentioned over here. Once that's done, well, we list all the literature in the paper, only primary literature, ideally no websites or lectures, only recent one, not a very old 1947 reference to show diligence, or use only appropriate ones, not just those where you have been an author once or your boss's name has been the author, or use only index journals, not any other journals. And again, reviewers don't like spelling mistake, grammatical errors. Stay focused on the research topic. Use past tense for accepted facts and past tense for reported facts, present tense for accepted facts. Avoid informal words, slang, superlatives, acronym. Avoid superfluous pictures. So thank you once more, Professor Joshi, for your kind invite. And I would like to mention Dr. B.K. Nayak, sir, who first introduced me into this world, and editors, Dr. Honavar and Dr. Natarajan, who gave me the opportunity. And of course, I cannot stop this without thanking my wife too, because it takes a lot of time to do that. And well, she allows me to. Thank you.